For one. So
Hi, everybody.
hi, Dr.
Thanks. I know a lot of you guys are very familiar faces. So I'm going to talk a little bit about our physical education, health and coaching minor. We are a little bit different, I think, than some of the other minors and dual licenses because we're actually primarily a grad level program. And so our minor is sort of unique in the sense that most of our coursework is for grad students, but we have some specifically designed for undergrad. So just in general about the minor, and this was taken really right from the bulletin, but that way I knew I couldn't mess it up. So basically we have this minor that can help you increase your knowledge about physical education, health education, coaching, and sort of things in between. Similar to the special ed, we have 14 credits of required core courses and then 6 credits of elective coursework. So I tried to sort of think about what might be particularly helpful to talk about. So one of the things is, you know, who might be interested in this minor, and so I tried to come up with some examples of when I think this would be beneficial. So one of them would be, you know, if you're wanting to be a camp counselor or you already are a camp counselor, a lot of the things that we'll talk about, you know, you can take classes in motor development, health and wellness, so there's lots of things that I think you could integrate, like PE 211, right, lots of movement activities and things like that, that you could integrate into your work at a camp setting. Another one is if you actually are coaching youth sports or you're into working with youth sports. Again, you could do more of your elective coursework in the coaching world and get some experience there. You know, this is like this nice broad idea. But you know, if you're interested in supporting the health and wellness of students, so that could be school-based, that could be community-based, but it does provide you an opportunity to have a nice foundation and understanding foundations of behavior, you know, interventions that you can use to support students that could really be useful across a variety of settings. I guess I already said this, but you know, if you're working in some other community setting, so maybe like at a Y, or you know, you're working with some sort of like daycare or any sort of setting in which, you know, having an understanding of development, health issues, ways to support health and wellness, just could be sort of an added benefit. If you're interested in working as a physical education or health education teacher, you also might want to take some of these courses. It does not mean that it will prepare you for licensure or that you will get a dual license, but it will introduce you to the field or the fields, and we could maybe work together. Like I've had some students who have done a 5th year here to get their phys ed or health ed license. So it would be easier if you started earlier and we're taking some of these courses. That actually might be, it will make it a little bit easier to do that, but just to be clear, it's not actually a dual license program. Maybe someday. And really just, if you have interest, you know, in movement, in health, in wellness, it's a really nice way to lay a pretty broad foundation where you get some core coursework, which I'll talk about in a minute, but you also have a lot of room to pick some electives where you can really focus on your areas of interest. So the required courses include SED 100 or 101, which is Introduction to Education, which also is required of all students who are in other licensure programs. So it's like 2 birds with 1 stone. SED PE 103, which is our Introduction to Human Movement. It's sort of like our broad course that covers different disciplines within the field. So you talk a little bit about exercise science, kinesiology, biomechanics, that kind of stuff. It's like a survey course. SED PE 250, community leadership through your sport coaching. I believe you actually get the opportunity to go out into the community in this course, so you get some experience in that. I couldn't separate these. I tried to get these to come up like 2 and then 1, but I couldn't make that happen. So PE 211, movement education, which again, a lot of you are already in, and it's required for elementary and special ed anyway. When you're an upperclassman, you can take 500 level courses. So if you were interested in really looking at physical education or health education methods, like actually doing that for a career, that would be a great course to take. And then many of you will also already take SED HE 221, Foundations of Health Education. So a lot of these are sort of double dipping. Yes, I know, we're just in it right now. And I'd like to think, sort of like Donna was saying, I think both PE 211 and HE 221, I guess also because I teach them, but I like to think that it does sort of change the way you think about teaching and change the way you think about health and wellness, not just for yourself, but for other people as well. So even if you're just interested, I think they're 2 nice courses to give you some things to sort of think about that might give you some perspective. So elective courses include a lot of different things. So you can see that, that you could take more methods around coaching, motor development, which actually does also touch on some issues related to like adaptive physical education and how to work with students with disabling conditions, psychology of sport, community health, applied nutrition, curriculum development, and then we often have PE or health ed courses over the summer that might be a little bit different that could also count as a minor. You can take, as I mentioned before, you can take 500 level, but it's usually reserved for at least junior status or above, so that could be later in your career. But I think this covers, there's a couple other graduate level courses, like we have a course about movement and physical activity in schools, which sort of takes PE to 11 to another level. It's like the 500 sort of level where you actually plan interventions. We have a special topics and health education course that you could take as well. So there are more options that are on here, but these are some of the more common ones that people tend to use. And I think that actually, I only did that in like 5 minutes, and those of you who have had me know that I never get through anything in that small amount of time. But I think,
you too?
yeah. We're always running out like of the last 5 minutes late. But I think that just gives you a general overview. So we're going to wait for questions at the end, so I won't ask for questions. I can just go right on.